Welcome to another episode of A Poor Man's Pharmacist. My name is Seth Haslam. I'm a doctor of pharmacy. Today I wanted to talk about over-the-counter medications and pregnancy. So which medications are generally safe and which should be avoided. The first class of medications I want to talk about are fever reducers and pain relievers. The one thing to remember is that there's a certain class of medications called NSAIDs, or non-steroidal anti-inflammatory drugs. So that would include ibuprofen, naproxen, ketoprofen. Those particular medications should be avoided in the third trimester of pregnancy for sure. They can be used in the first and second trimester, but as you begin to get closer and closer to the third trimester, it's a good idea to stop using them and use Tylenol. Tylenol is safe, so that's acetaminophen. Tylenol is safe in all three trimesters up until the very end. But again, NSAIDs you want to avoid in that third trimester of pregnancy. The next classification of drugs are decongestants. So I recommend doxylamine and diphenhydramine. You want to avoid pseudoephedrine or Sudafed and phenylephrine. So the doxylamine specifically can also help with any morning sickness issues that you're having. Diphenhydramine or Benadryl can also be used as well. It's safe in all three trimesters. Brand name of doxylamine would be Unisom. The next category is medications for diarrhea. So there are a couple that you want to avoid that should be used only for the duration of your symptoms. Imodium, over-the-counter Imodium, should be used just for as short a time as possible. You want to avoid Pepto-Bismol. That is very similar to aspirin, which is an NSAID, and we just talked about how that can be an issue. So in pregnancy, avoid Pepto-Bismol. I would recommend the one medication I think that is completely safe in all trimesters would be kaopectate. So that's kaolin and pectin. And the reason I recommend that is because it's not absorbed through your gut. So it's going to help with the diarrhea, but it's not even absorbed. So it won't be absorbed. The baby won't get any. The next class of medications are medications used for reflux, stomach acid. It's okay to take an over-the-counter Maalox, Mylanta. The medications you want to avoid, though, are known as PPIs. So that would include, PPI stands for proton pump inhibitor. That would include medications like Nexium, Prilosec, Prevacid. Generic names would be omeprazole, esomeprazole, lansoprazole. You want to avoid the PPIs because safety can't be completely verified with those medications. However, it has been shown to be safe to take what are called histamine blockers or H2 blockers. Those would include brand names such as Tagamet, Zantac, Pepcid. Generic names are cimetidine, famotidine, ranitidine. Those would be fine, along with Maalox and Mylanta. And these recommendations for stomach acid reducers, that applies to all three terms of pregnancy. The last category I want to talk about are medications for yeast infection. So in the first trimester especially, it's generally a good idea to avoid any oral antifungals. However, the over-the-counter products are completely fine to use, and they're okay to use throughout the entire duration of the pregnancy. However, if that yeast infection persists, it may be a sign of something else, a complication of your pregnancy. So you need to get that checked with your OBGYN as well. That's all of the medications I wanted to cover this week, all of the over-the-counter medications for pregnancy. If you know someone that this video would help, send it to them. Also, if you would help us out by subscribing to our YouTube channel, Poor Man's Pharmacist. Thanks and have a great week.